If you are over 65 and your doctor is still aggressively pushing your blood pressure down to 120 over 80, I need you to stop what you're doing and listen very carefully for the next few minutes, because what I'm about to share with you could literally save your life, or at the very least, save you from a broken hip, a head injury, or the kind of fall that ends independent living forever. A landmark study published in the Journal of the American Medical Association followed more than 15,000 adults over the age of 75 for 5 full years, and the results shocked the researchers themselves. Seniors with that so-called perfect blood pressure of 120 over 80 had a 28% higher risk of serious falls and a 14% higher overall mortality rate compared to seniors whose systolic pressure sat comfortably between 130 and 140. Let me say that again, because it's that important. The number your doctor keeps chasing may be the very number putting you in the hospital. I'm doctor, and after more than 2 decades treating seniors in clinical practice, I refuse to stay silent about this anymore, because every single week I see another 75 or 80-year-old wheeled into a hospital with a fractured hip, a concussion, or worse. And nearly every time the chart tells the same story: aggressive blood pressure medication, a nighttime trip to the bathroom, a moment of dizziness, and a fall that changed their life forever. Before I go any further, I want you to do something for me right now. Drop just your age in the comments below, and if you have ever felt dizzy, lightheaded, or had to grab the wall when standing up from a chair or getting out of bed, type the word dizzy next to your age, because I read every single comment and I want to see exactly who is watching this today and who urgently needs this information. Now let me tell you about a patient who came to me last year, a sharp, active 78-year-old gentleman who had walked 2 miles every morning for 30 years. His previous doctor had slowly titrated his medications until his blood pressure read a beautiful 118 over 72, and on paper, he looked like a textbook success story. But one night, he got up to use the bathroom, his blood pressure dropped, the room spun, and he hit the tile floor so hard he fractured his pelvis, spent 6 weeks in rehab, lost 15 pounds of muscle, and never walked those 2 miles again. And the tragedy is that none of it was necessary, because the guidelines that pushed his numbers that low were never designed with a 78-year-old body in mind. Here's what they don't tell you at most appointments. The body at 75 is not the body at 45, and there are 3 specific physiological reasons why seniors need completely different blood pressure targets than younger adults. The first is arterial stiffness, and I want you to picture this clearly. Imagine a brand new garden hose, flexible, soft, able to expand and absorb pressure when you turn the water on full blast. And now picture that same hose after it sat in the sun for 40 summers, cracked, hardened, rigid. That is exactly what happens to your arteries after 60 years of life, and when arteries are stiff, they need a slightly higher pressure just to push blood up to the brain against gravity, which is why forcing the numbers down artificially literally starves the brain of blood flow. The second reason is that your baroreceptors, the tiny pressure sensors in your neck arteries that tell your body to adjust blood pressure when you stand up, become sluggish and slow with age, so when you rise from a chair, instead of your body instantly raising pressure to keep blood flowing to your brain, there's a delay, and during that delay, you get dizzy, your vision tunnels, and you fall. And the third reason is medication metabolism. An 80-year-old liver and 80-year-old kidneys clear drugs far more slowly than they did at 50, meaning the same dose that worked perfectly at 55 can now accumulate to dangerous levels at 80, silently dropping pressure far lower than the reading on the cuff suggests. The JAMA Internal Medicine study I mentioned earlier, 15,142 adults over 75, followed for 5 years, found that the lowest mortality, the lowest rate of strokes, the lowest rate of heart attacks, and the lowest rate of serious falls all occurred in the group whose systolic pressure sat between 130 and 140, not below 120, and that below 120 the fall risk jumped 28% and all-cause mortality rose 14%. And yet most primary care offices are still using the exact same target numbers they used 40 years ago. Now, I want you to walk through this scenario with me as if it were happening to you. You're 76 years old, you feel fine, you go to your annual checkup, your pressure reads 142 over 82, your doctor frowns and adds a second medication. 3 months later, you're at 128/76, another frown, another dose increase, and now you're at 122/74. The chart looks perfect, but you've started feeling strange when you stand up, the room sways a little, your legs feel heavy in the morning, you find yourself holding the kitchen counter just in case, and when you mention it, your doctor smiles and says, "That's just getting older." Except it isn't. It's medication-induced orthostatic hypotension, and it is the #1 preventable cause of catastrophic falls in seniors today. So here's a simple test you can do at home this week, and I want you to actually do it. It's called the Orthostatic Vital Sign Test, and all you need is a basic home blood pressure monitor, which costs about $30 at any pharmacy. Step 1. Lie flat on your back for 5 full minutes. No phone, no television, just breathing. Step 2. Check your blood pressure while still lying down and write the numbers on a piece of paper. Step 3. Stand up immediately and recheck your pressure within 60 seconds of standing. Step 4. Compare the two readings. If your systolic, the top number, drops more than 20 points, or your diastolic, the bottom number, drops more than 10 points, you have orthostatic hypotension, and that is a red flag your doctor needs to see. Now let me give you something even more valuable. Age-banded blood pressure targets that reflect how real bodies actually work, based on the most current geriatric research. For adults aged 65 to 74, a reasonable systolic target is 130 to 140. For adults aged 75 to 84, the target shifts upward to 135 to 145. And for adults 85 and older, or for anyone who is frail, has fallen before, or lives with multiple chronic conditions, the target is 140 to 150. And in every one of these bands, the diastolic, the bottom number, should stay above 65, ideally between 70 and 85, because a diastolic below 60 in a senior starves the heart muscle itself of blood flow and sharply increases the risk of heart attack. But here is the most important principle I want you to take away from this entire video. Treat the patient, not the number. I had 2 patients, both aged 81, both with a reading of 142/82, and on paper they looked identical, but one was frail, walked with a cane, had fallen twice in the past year, and was already on 4 medications, while the other played golf 3 times a week, lived alone, drove at night, and took nothing but a vitamin D pill. The first patient I watched carefully and left his medications alone, because lowering his pressure further would almost certainly put him in the hospital, while the second patient I had a longer conversation with about gentle lifestyle changes and a low-dose medication if needed. Same number, completely different decisions, because the number on the cuff tells you almost nothing without knowing the whole person it belongs to. So here is exactly what I want you to do this week. Step 1. Buy a home blood pressure monitor today or tomorrow and log your readings every morning and every evening for the next 2 weeks, sitting quietly for 5 minutes before each reading. Step 2. Perform the orthostatic test I just described at least twice in those 2 weeks. Step 3. Be brutally honest with yourself about symptoms. Are you dizzy when you stand, tired all the time, foggy in the head? Is your heart racing? Are you falling more than you used to? Step 4. Schedule a targeted appointment with your doctor specifically to review your blood pressure medications. Bring your log and your orthostatic numbers with you and ask the question I want every senior watching this to ask out loud. Is my target blood pressure appropriate for my age, and could my current medications be putting me at risk for falls? And step 5, speak up, because too many seniors suffer in silence, thinking dizziness or fatigue is just getting old, when in fact it is a medication side effect that can be corrected in a matter of weeks. If this information helped you or changed how you think about blood pressure, after 65, I want you to type the word informed in the comments below so I know this message reached you, and please, please share this video with every friend, sibling, parent, or neighbor over 65 that you know, because one conversation, one shared video could be the difference between them keeping their independence and ending up in a nursing home after a fall. Subscribe to this channel so you don't miss what I'm covering next, because in my next video I'm going to reveal 3 natural supplements that support healthy blood pressure in seniors, and 2 very popular ones that are a complete waste of your money. Remember, this video is for educational and informational purposes only, and is not a substitute for medical advice. Never, ever stop or adjust any prescription medication without first speaking with your own healthcare provider. Your doctor is your partner, and the goal of this video is to help you walk into that office as an informed, empowered, active participant in your own care. Because at 65, 75, 85, you are not a number on a blood pressure cuff. You are a whole human being, and you deserve to be treated like one.